Hey guys, let's chat about ADHD medications. There are lots of different options and there's a lot of confusion about what the differences are, what is usually first line, etc. Okay, first let me say that medication is not for everyone. Some people don't tolerate the side effects, some people can just deal with it with natural methods, but for some people it is a lifesaver. Okay, so let's not judge ADHD medications as a whole. Now, there are three main classes of ADHD meds. Number one is going to be your methylphenidates. These are generally considered first line. Number two is going to be your mixed amphetamine salts. And number three are going to be non-stimulant options. Methylphenidates include things like Ritalin, Concerta, Quilivant, Quilichu. These medications are first line for good reason. They're generally pretty well tolerated if taken at the correct dose. And usually patients will be started on a long-acting methylphenidate, and if necessary, you may add a shorter-acting one for later in the afternoon for a little pick-me-up as the longer-acting one starts to wear off. If for some reason the methylphenidates are not doing the trick, the next option would be amphetamine salts. Now, these tend to be pretty effective, but they do come with a lot more side effects in general. Things like headache, stomach ache, appetite suppression, difficulty falling asleep, and these mixed amphetamine salts go by the names of Adderall and Vyvanse. The last option are non-stimulant medications, things like Strattera, Qelbree, Clonidine. Now, these medications will take longer to work. They kind of have to build up in your system, and also they generally tend to be less effective than the stimulant options. A lot of times we will see these added on to stimulant options for the optimal regimen. The nice thing about these medications is that they're generally very well tolerated. They tend to have fewer side effects than the stimulant medications, but like I said, generally just not quite as effective for most people.